This episode is going to be about shockwave therapy. This I just started recently, and the reason I started is because I had it done for my knee, and it helped tremendously. And it's non-invasive. You know, basically it's just high-energy acoustic waves to stimulate healing in the tissues of the body. Listen, it's helpful in a lot of arenas, and that's why I incorporate it into my office because of the musculoskeletal type stuff, you know, the tendons. It really produces healing in the body. It helps the body tissues regenerate. You know, and it's not painful. Sometimes it hurts a little bit. It's not a long treatment. You know, it's short. It's only 10 minutes the most. Maybe a little longer if you're doing a couple parts, you know, but the whole thing in 20 minutes, you get everything. The whole treatment is complete. And it's very good with chronic issues because it gets a lot of scar tissue and adhesions, and it helps break that up. And like I said, it's a simple treatment, you know. You put some gel on the area that's affected so the handle glides better, and you know, you set it for what it needs to be set at, and then it just does, you know, makes a little sound, you know, like a thumping kind of sound, and it gets blood flow, it gets oxygen and nitric oxide to the area to help with the dilation of the blood vessels and get more healing to the muscles, tendons, and ligaments. So I'm going to explain a little further about what to expect if you choose to come for a shockwave treatment. If you ever had ultrasound done or anything like that, it's like looks like that, the handle, and then there's of course the device itself, which is basically a box that has programmable settings on it, and you pick one. For say you came for knee pain, pick the one for knee or elbow, whatever it may be, tennis elbow. Knee pain, they're very good with that. That area of the body needs to be exposed. What I mean by that is I have to get to the skin, which the elbow and the knee is kind of simple. I have gowns for people if I need to do that, or tell them to dress comfortably with shorts or something where I could just expose that area because you put a little bit of gel on there to help with the gliding of it. You don't want any friction with the device. Basically, that's pretty much it. And then you lay down or sit up, depending on what I feel is most comfortable and effective for the person. And then you start the treatment. And when you first start the treatment, you'll hear like a dun 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 dun. It's a noise because you're producing shock waves, right? It's an acoustic treatment, you know, but it's contained, you know, in a small device. And you're going to hear something. Might be a little uncomfortable sometimes, but usually when it is, that's okay. And it subsides as the treatment continues. So it's basically that's all it is expose the area, put some gel on it, set the machine for what the treatment protocol is going to be, and then I apply that to the area with the handheld device. And it varies, you know, the actual treatment that machine's going can be anywhere from 3 to 7 minutes. It works tremendously with plantar fasciitis. You know, I've been getting great results with people with it. You know, some people it takes a little longer to respond, and other people are quicker. Depending on how long they had the condition, it makes a huge difference. You know, it's the same thing. Come in, do it 10 minutes or less, that one treatment, and if I do it twice. And the results have been really good. And another thing, too, with low back pain. I have a patient that's been in pain since she was 18 or 19. She had an accident or something. She's in her 60s now. With the shockwave therapy, she's been pain-free for a while. So, and we're still working on that. I have a patient that's coming to me now for plantar fasciitis, and, you know, she's been struggling with it for years. And she was always asking me, why didn't anybody else tell me about this? I said, well, maybe they didn't know. I said, I don't know. I said, but I'm just happy it's working. It's helping, you know. She's only had like 3 or 4 treatments, and the results are phenomenal. I get shocked myself, no pun intended, right? Shockwave, get it? I do, at the results, because I don't use many instruments in my office. And when I get something that works and minimal side effects, if any, it's a good thing. Non-invasive, drug-free, and you could use it for just about anything. Just like I said with the acupressure and the different things that I use, shockwave therapy is a little more specific for patients. Not everybody needs shockwave therapy. There's some things you can do. There's stimulate healing and acupuncture points, acupressure points that I could use. But I find that most patients don't need that extra boost, but some do. And when they do, I'm happy that I have that to offer for them. I always get questioned, like, how do I know if shockwave's for me? I said, just go on YouTube. There's like 9 million videos that tell you what it's good for. That's a joke, right? But it's true. It helps many different things. I use it mostly for musculoskeletal stuff. plantar fasciitis, tennis elbow, knee pain, shoulder pain, some neck and back, low back. It helps tremendously with the back, with the disc and all those type of things. I would say the best way to see if you're a candidate for it is, book an appointment. I'll do a consultation for free and explain everything to you. Or on the phone, whatever's easier, and I'd happily let you know. But if you're having chronic pain and you have no, fractured bones or anything like that, or anything that would be contraindicated, which are not too many that are, to be honest with you, it'll benefit you. Chronic pain is one of the best, and plantar fasciitis and tennis elbow and golfer's elbow, because they're usually reoccurring things. They do get fixed sometimes by some people, but they seem like they don't last as long. And what I find with the Shockwave Therapy, the results last longer. Once you're healed, you're pretty much healed. Maybe you have to come back once in a while, because it really does promote healing of the tissues. Hey guys, do me a favor, follow us and like us on social media, and visit our website, NewJerseyTotalHealth.com.